Welcome to the office. How can I help you? So, tell me, what's your story now? You guys came a long way.
Not sure. I just want help with the low back,
Okay.
my neck. I got a pain in my foot there. I was told I had a spur there on the heel.
Okay.
Got a bunion there.
Okay.
And,
Let's rewind a little bit.
okay.
Okay. So, or let's start. What are the top 3 reasons you're here? What was number 1 that drove you to come here?
My low back.
Your low back. Okay.
That's the main.
And you've been dealing with it for a while?
Yeah.
How long?
About 30 years.
30 years. What happened 30 years ago? We're starting somewhere and then we're going to kind of go through the story. Yeah. So what happened 30 years ago?
I fell when I was 6.5 months pregnant.
Okay.
And then when I had my first child, it was like, either my tailbone was out or broken because I couldn't sit while I nursed them.
Okay.
And so that was the journey.
Now, when you started did you have a C-section?
Mm-hmm.
Went through it. Okay. How about the others?
No, they were all natural too.
All natural births. Okay, so that's good. But the back pain was there.
Mm-hmm.
Did you get an epidural during any pregnancy? Okay. What did you do then for the back pain?
I used oils, essential oils,
Okay.
lots of them.
Okay. And did that help?
That helped.
Okay. So you were able to manage through the pain.
I was.
And you're coming from
Pennsylvania.
Pennsylvania. Okay. Good. Now let's rewind. You did essential oils. Did you do anything else?
Went to
Back
different
then,
chiropractors.
back then? So you've seen chiropractors
Lots of good ones.
historically.
Yeah.
Okay. And back then, when you started to see chiropractors, did you get any x-rays done?
No.
Okay. So it was basically going off the feel,
Mm-hmm.
finding what the issue is. Did anyone tell you what the issue was?
Not really.
Not really.
No.
So you just kind of went, you got some adjustments. Did you get some relief?
I did get relief.
Okay,
Yeah.
so you got relief. Were you going periodically, or you went for a few visits, felt good, and then kind of whenever you started to hurt, you went?
We actually had a guy come to our house for about 10 years
Nice, okay.
to work on muscles, and that.
House calls.
Yeah.
Cool.
That really helped.
Okay.
I think that's kind of what kept me going for
Okay.
those 10 years.
Okay.
That's when I
And
had my children.
any issues raising them physically with your body? As long as you're getting adjusted, getting body work done, you're able to physically take care.
Yeah.
Okay. Breastfed?
Mm-hmm.
Okay. At least a year?
Yeah.
Okay. All right. Now, let's fast forward a little bit. What was the next injury after the low back? Or what was the next issue that came
The
up?
next issue. Well, before that, I was in a car accident.
Before when?
Before the childbirth.
Okay.
When I was 17. I had my collarbone broken. I had a concussion
Okay.
and just a small bone broken in my arm.
All right. Did you have treatment back then? No treatment. Okay. All right. So 17, car accident, broke your collarbone. Obviously, some things went out of alignment.
Mm-hmm.
Okay. Just dealt with it.
Yeah.
Yeah. Just dealt with it. Toughed it up.
Yeah.
Okay. And you got married when?
When I was 26.
Got it. Okay. That's the guy right there.
He's the guy.
All right. We're gonna deal with you in a minute. All right. All right. We'll start with it. Okay. So low back,
That's the main issue.
main issue. Car accident, I know happened prior. That's fine. What happened next in the body?
I'm not sure, but it just seems like it's all on this side. Arm, leg, foot.
When did the arm start?
Just in the last couple of years.
Were you doing something? Did you injure it?
Not
That
really.
you recall?
This was the side that the collarbone was broke.
Okay, so then we have things that have been affected
Mhm.
structurally.
Yeah.
They put any pins in there?
No.
Okay.
Just let it heal like that.
Okay. Did they set it for you? I'm
No.
assuming.
Well, I don't know.
All right, well, we'll take a look on the X-ray, what it looks like. Okay. So whole right side has really been affected.
Mm-hmm.
Okay. Right shoulder, right hip,
Mm-hmm.
right leg.
Yeah.
Shooting pain down the leg at all? Any sciatica type
yeah.
shooting pain?
It's kind of right here right now.
Okay. On the thighs? The front of the thighs
Yeah.
or the whole leg on the top?
The whole leg on the top,
Okay.
and sometimes down the leg. Not always,
Okay,
but it's a lot right here.
all there. And does it go past the knees at all?
Sometimes.
Sometimes. Are you doing something when it does that?
Not really
Okay.
that I can recall.
And activities. So growing up, high school, out of high school.
Not high school. 8th grade.
8th grade. Okay. Any sports? Any activities?
I wasn't real good at sports.
Okay. What did you do? Did you go for walks? Any activities? You stayed
Yeah.
home,
I
did
played ball.
housework, chores?
I played volleyball and
Okay.
softball, but I wasn't a real good.
Were you active though?
Oh, yeah.
Actively moving?
Yeah, unloaded hay, lifted the bales,
Okay. So you're on the
on
farm.
the elevator. Yeah,
Okay. So you did a lot
carried
of
milk.
That's a lot of work in itself. So you got your workout
My
doing.
dad would tell me, "Don't lift so heavy," and I wanted to see how much I could lift, which was probably not good either.
Okay. So you're doing hay, milking as well, carrying the milk or doing the milking,
Doing the milking
and carrying
and
the milk
carrying it.
and the hay. Okay. Plow. Machines.
Yeah,
Okay. Back then. All right. Okay. Let's fast forward now. Next issue, you mentioned something about your foot. When did the foot start?
last summer I couldn't walk on the heel,
Okay.
and so I got an X-ray. They said there was a spur here and here.
That's it.
I think that's it.
So mainly is back and foot.
Yeah.
Okay. Now you've seen a
And
lot.
shoulder.
And shoulder, left shoulder.
Yeah.
But you're saying right side hurts.
It's right side, but right now this is kind of the. I went to another chiropractor. He got this loosened pretty good. I used to get a lot of headaches.
Okay.
He loosened this shoulder, and now it seems to be I'm dealing with this one.
So it switched sides.
Mm-hmm.
Is it the same spot on the opposite side?
Basically.
Okay. All right. Now, when we're looking at extremities and shoulders in particular, shoulders, we'll talk again more in the report, but the shoulder joint complex is under 100% neurological control, which means if there's a nerve interfered or severed going to the shoulder won't stay up. Okay? Number one. Number two, if someone tells me it switches sides and it's in the exact same location, then I'm always thinking spine first. Okay? Bilateral, switch sides, knees, feet, elbows, any of that. I'm always thinking spine first, clear the spine.
Mm-hmm.
Okay? And you had treatment for this. You brought me x-rays. You've seen other doctors for this. Okay. In those x-rays, we took a look at the older x-rays. We're comparing them to what you have today. We're going to be going off current x-rays, not previous x-rays. Okay? And I will explain what I see. I'm going to watch your walk. I'm going to examine you, go over your x-rays, and we're going to figure out where we're going to start today. Okay? And whatever I find, I work on.
Okay.
Fair enough?
Sounds good.
And if you have any questions, you stop me along the way.
Okay.
And after your visit, we got a special couple, so we're going to be taking care of both of them in this visit today. Right? First is wifey, then his husband. Okay, so why don't you stand up and let's go ahead and watch you walk. Hers is very subtle. Okay. So she walks on the
I feel like I'm
side. She
very-
walks kind of off balance. What I'm trying to get at with her is it's subtle. That pelvis is subtle. That left pelvis is subtle, and the reason it's subtle is because of the right short leg slightly lower on the right side. Turn around. Now, I want you to take 2 steps forward and march in place, please. And put your knees out in front of you when you march in
Like
place.
this?
Yes, ma'am, like you're marching. Okay, so you can see when she does the right side, it moves. The left doesn't move as well. When she does the right, keep going. Keep going. Okay, now close your eyes and keep marching. And you're going to see she's going to start going forward into that left side. That's the pelvis. Okay? You see, she kind of keeps veering that way. This is a left pelvis issue and sacrum. Come back over here, please. Let's continue walking. Now walk how you normally walk. Now you can see that jiggle, right? You can see it wiggling back and forth. No pun intended. And then you're tilting to that right side. And she's tilting to the right side for two reasons. One is her L5 is tilted, and two is that leg length is a little shorter on that right side. Okay, keep going one more time, please. Okay. Have a seat over here. And let's go ahead and examine her and look of what's happening in her spine. So let's look and see. We can see it goes like this. It curves. You can see the spinuses here. You can see this muscle a little more pronounced here. You can see it a little more pronounced on this side. And then it disappears in here, the spinuses. And then it comes back out right about here. And then it disappears and dishes in a little bit. And it comes back out. Left side is higher, right side is lower. You can see the creases here, a little bit asymmetrical. Yes, this one and this one. And you can see this appears to be bigger than this. That's her spine. So everything is kind of compensating here. We would like to see her sitting up like that. Obviously not with this, but this should be her norm. Okay? And hopefully get a little bit of this. I'm not trying to straighten her spine out, but if it's due to nerve pressure, that would be kind of nice there. Okay, go back to your norm. Your current norm. Okay. Now let's run the meter on the back and let's see. You all see a little pimple there, right?
Yeah.
So we were taught this thing, when you see a pimple, it's kind of like a stop sign on the back, if it's on the spine especially, but we kind of go bisect it to the spine, and sometimes, a lot of times there's something there.
I couldn't figure out there's one here and
Okay.
then one up in here.
Okay, well, we'll take a look at it. Let's see what we find now. And the first thing is, we got a 25-point reading. Guess where? 20, 20. You see that, sir?
Okay.
All right, so that's the first one. Now, you notice there, that didn't stop. It kept going. That's not a break. So what's interesting with you, ma'am, is you don't have, especially in the low back, these consistent breaks.
That should be there.
That's where it starts. No, it's like going, but it wants to stop, but it just keeps going.
Okay.
This is all compensating these muscles. Now, there may be something hiding in here, but we're not starting there. So I'm finding two majors with you, ma'am. I'm finding here and here right now. Okay? Now, let's check the neck. No, I'm not starting up in here. I'm starting in the upper back and down low. And the down low is really the main issue and why you're here. Okay? So that's down low, S2, S3, and that's around T4, T5. Let's statically palpate. Just running my fingers down the spine. As I run it, you can see right there the tissue changes. It starts to get swollen right there, orange peel, and it starts to go to the center of the spine right there. How's that one?
That's sore in there.
Bottom or top?
Top.
How about that one? I feel this one.
Right there.
Yes, ma'am. That's the spicy one. 7, 1, 2, 3, 4. Number 5. 5. 5. Excuse me, sir. Now, as we run the fingers here, start to get to around the T11, 12. Still not bad overall. But then right when we get there, low back, that's where it starts to pull all the way down into sacrum L5. This is L5, ma'am, okay? This is S1, this is S2, right there. That's S3, that's S2. I feel this one right there. How is that one?
That one's not bad.
That one's not bad. Compare it to
That one.
That's the one I feel. How about down low?
I feel that one too.
Okay, is this one sharper? That's S3 or S2? I'm going with the bottom one, right there.
But that one hurts too.
That one too, okay. Let's try that again. L5, S1, S2, S3, S2. Right there. Scoot forward, please. Is that correct, ma'am?
Yeah.
S2 or S3?
S2.
Yeah. Okay, let's check the movement in the pelvis now. I'm on the SI joints here, feet together. Open and close the knees, please. Open and close. Left side only. When she does the left, nothing's happening on the right. The right's fine. Right side only. When she does the right, you're getting a little more movement. Is one side harder than the other? Sit up straight, please. Watch this, sir. So I'm right here in the SI joints. Go ahead and move the right side only. So when she does the right, the left is shifting with it under my thumb. Do the left side, but when she does the left, there's very little movement from the tissue, but the joint is staying intact. So this is a left pelvis S2 T5 issue. Okay? We found T5 and S2 on you based on the exam. Now we're going over the x-ray. And what did we discover on the x-ray? You actually have a transitional vertebrae or 6 lumbars. Now, there's a percentage of the population that has either 4 lumbars or 6 lumbars. And what does that mean? It doesn't mean that you have an extra bone or extra nerves. It just means it formed a little different. And the way that forms is this. Your first sacral tubercle took on the characteristics of the lumbar. If we look on the model, it'll show a little bit better. We have the 5th lumbar, which is the lowest, and then we have the first sacral tubercle. So in this case, the first sacral tubercle took on the characteristic of L5, making it appear to have 6 lumbars. Versus someone who has 4 lumbars, that 5th lumbar takes on the characteristic of the sacrum. That's called sacralization. Yours is called lumbarization. Have you heard that term before?
Yes.
Okay, so we're on the same page.
I'm watching the videos.
Oh, okay. Did anybody else tell you that?
Not that. No, not
Okay.
that term.
Now, we can see here on this L5, L6, there was some damage there. Was that from the way it was formed? Was it from the trauma? Was it from both? It could be all of the above.
Mm-hmm.
I can't tell you which one it is.
Mm-hmm.
There's just a bunch of stuff happening there. Okay? Make sense?
Makes sense.
All right, so what do we see here and what is this all about? This work is based on, we said, the level foundation principle. In order to have a stable building here, we need to have a level base and foundation. And what does this foundation tell us? PI5, IN10 with P13L. What that tells us, and then we have a measured difference of 5. The left pelvis, the pelvis works like this. One goes up, the other goes down, one goes in, the other goes out. Left pelvis goes down, so the right one is up. The left pelvis turns in. I'm referencing the back turns in. So your pelvis favors to the left, but your spine goes to the right. That's the disconnect in your low back. Understood? That disconnect is from trauma, yes. And we have to figure out where we're going to start to actually stabilize and fix this. Okay? Now, according to the chapters, the Gonstead chapters. There's a rule of thumb, page 43 of the chapters. IN with a rotated sacrum, we go at the sacrum. Okay, rotated sacrum. If this was a EX, PIEX, we would go with the pelvis. So your cases, we're going to start here. Okay? So we're going to start down in sacrum. Now, we palpated S2, but what is it really? S1.
S1.
Because you have L6.
Okay.
And without the film, we don't really know that. Okay? It's really important to have that film, to have a comparative full spine so you can see at least the A to P. You can see everything in its entirety. You can have an accurate count. You can see transitional segments. You can see things that are fused or not, and how kind of the whole body presents. It is a picture in time. It just tells us how you've evolved and how you've developed. Okay?
Mm-hmm.
It's not the end-all be-all. Got it?
Yeah.
So we're going to start where with you, we said? Rotated sacrum. Now, we're going to go later on into this compensation, decompensation. The films you brought me had a lot of different markings on there, okay? Right now, I want us to focus on pelvis, and I'm going to list T5 as what we found on you, okay? And T5 is going to be a PRI-T. So we're going to focus on that and that. Then we're going to tune up your ankles, shoulders, elbows, and wrists. And I may work on your nose next visit for the breathing in the septum.
Okay.
Okay? Sound good?
Sounds good.
Are you ready?
I'm ready.
All right. Face down, please. Showtime. Let's get started. Sir, are you going to help? Oh, yeah. You going to help?
I'll watch.
I need your help. You have to hold on to the leg. Okay, so you're going to lightly place your hands, lightly. And they may do that.
Okay.
Okay? Just catch them, don't push them. So, we're doing sacrum. Now, the challenge in her case is, side posture is a challenge with her, and the reason why is, we talk about the high side of the rainbow, so we would have to do it as a involved side down, left rotated sacrum, but that's a little challenging in her case, so I'm going to start it off here and get things going. Okay, ma'am? Let's do it. Right. Enough talking. Will you get to work now? There we go. I'm just pumping the disc. Breathe. Deep breath in. Blow it out. Deep breath in and out. Deep breath in and out. Keep going. Good. Keep going. There it is. And that's a home run, lady. You heard that? Ma'am?
What?
Tell him you're okay.
I'm okay.
T5, PRI-T. Gotcha.
What works better?
I'm not saying nothing. Why don't you tell me what you see, sir? What's different? She's not wobbling on the feet.
Yeah, her feet work much better.
What you think, lady?
Yeah, I feel more stable.
Keep going. Is that the kind of adjustment you got?
Yep. And it wasn't fun walking.
No, is that the kind of adjustment you got before?
No. He didn't do it like that.
Okay. Well, now we have a reference, right? There you go. Have a seat, ma'am, and let's rescope you and let's see. All right. Look what she said.
Much better.
Look,
Yeah.
ma'am. Does that hurt to sit like that?
No?
So guess what? We got a new normal for you now.
That's what I've been wanting.
That's pretty cool. Now let's recheck. So in her scenario, what you're going to see, I'm going to have her walk several times. Things are going to be shifting around. As I scope her a few times, like now it's clear. Things are going to balance out.
Mhm.
Okay, she's had this for a while. There we go. It's clear. 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 Feet together, open and close the knees, please. Right side only. Well, what do you know? Left side only. Not bad, right? That left side should be moving a little bit better. Right side only. Scoot back for me. Let's check the movement in that low back. Back towards me.
But it's gone.
S2. Seriously?
A little bit, but not bad.
What's that?
I said it feels a little bit, but not bad.
Little sore?
Yeah.
Any things sharp shooting down your legs? Any numbness in your thighs right now?
No.
Pretty good, lady. Now, can I tune up the rest of you?
Yeah.
Okay, let's do this. Pretty cool. Let's do the shoulders. Okay, right shoulder. Let me do the work. Sir, I'm okay. Just making sure. Gotcha. Over, around. There you go. Ears. Gotcha.
Oh, I can't hear in this ear.
Uh-oh. Go on your back, please.
I forgot about that.
I'm sure things are going to shift around over the next day or two. You got homework, lady. Water, walking, nice, simple. And have a good time in LA. There you go. Stand up for me, please. Walk it off again, and then I'm going to work on your hand. So one of the side effects you're having is you're breathing better.
Yeah.
But I'm not treating breathing.
No.
Okay. Just making sure. Squeeze.
Got some numbness in here sometimes.
Squeeze. This is a humerus. Medial humerus. There you go. Distal radius. Posterior lunate. A little more. There. Posterior lateral scaphoid. Roll it over. Set. Squeeze. Go like that 5 times, please. Squeeze my hand. Squeeze. You're all set for
Thank you.
today. You're welcome.